Hi, I'm joined now by Dr. Kim Rain from the University of Alberta. Kim is a professor and the Associate Dean of the School of Public Health at the U of A in Edmonton, and she's also a Fellow of the Canadian Academy of Health Sciences and a registered dietitian. Dr. Rain's research program, POWER, and the acronym means Promoting Optimal Weights Through Ecological Research, explores the social determinants of the obesity epidemic and policy and community-based population interventions to promote healthy weights and prevent chronic disease. She's a member of the Scientific Review Committee for the Healthy Kids Community Challenge. Welcome.
Thank you. It's good to be here.
It's nice to have you. Can you give us a bit of background on the history of the Alberta Nutrition Report Card on food environments for children and youth? That's a big, long handle. Can you kind of break it down for us?
And I'm really glad that you said it first because I can never get it straight. So the Alberta Nutrition Report Card on food environments for children and youth we're in our third year. 2017 is our third year, so we started in 2015. What we decided to do is we know that food environments influence children's eating habits. So, for example, if kids are exposed to a lot of marketing, they want to eat the things that they see being advertised. If there's a lot of junk food in their recreation center where they go to play hockey, that's what they ask for when they come out of the hockey game. So what we wanted to do was get an idea of what do kids' food environments look like in Alberta. And what we did is we explored all of the literature, that's what researchers do, around what we knew about food environments for kids, and we came up with this report card that covers 5 food environments, and then we have 36 different indicators in this report card that delve into each of those environments a little deeper. And what we do is we collect data on each of these indicators, and then we have an expert group that actually comes from across the country, and we score how we do on each of those indicators. And then, of course, like any report card, we come up with an average.
What would the environments be?
The 5 environments be? Sure. First of all is the physical environment, and basically that's what's available. What are kids exposed to? So that's things like what food is available in schools, in recreation facilities, and even where stores and convenience stores and fast food outlets are located in neighborhoods. That's that kind of thing. The second is the economic environment, and that is really around how much do things cost? Is it affordable for families to feed their kids a healthy diet? The third is called the social environment, and that's really around norms and values, what is considered normal for people to eat. And then the fourth is the communication environment, and that is the messages that kids receive. So whether or not that could be marketing, seen commercials, it could be nutrition education in schools. Those are the types of things that we look at in the communication environment. And then the final really is an overarching environment that incorporates all of those other ones, and that's the political environment. And that's around policies and strategies that governments put in place to protect children's nutritional health.
So how are we doing in this province?
In 2017, the overall score for the Nutrition Report Card was a C. So we're not failing, but
we're skating by.
We're skating by, and think about if you were a parent of a kid who brought home a C average on the report card, you might say, you can do better. And that's what we're saying to Alberta.
Do we shine in certain areas?
Yeah, we do. As a matter of fact, we had a B for the political environment in that there's a lot of policies being put in place to support kids right now. We actually gave an A for actually having guidelines for kids and nutrition in certain settings. So we have something called the Alberta Nutrition Guidelines for Children and Youth. They've actually been in place since 2008, so almost a decade, and they provide guidance for schools, recreation facilities, and daycares on providing healthy foods. So just by having those guidelines, that is considered a good thing. So we gave an A. The problem is that they're not mandatory, so they're not always implemented. So, for example, many school districts. School District 51 actually has made it mandatory, so probably are doing better than the rest of the province. But many school districts haven't made it mandatory. So schools are still faced with, trying to make money by, making money off of the vending machines, but that's at the expense of kids' health, right? So we did give a C to schools overall in the province. I think probably in this area we would give a B because of the mandatory adoption of the guidelines. But let me tell you, in places like recreation facilities, we're given a D. and again, just think about it. You take your kid to play hockey or go to swimming lessons or whatever it may be, and they come out after being physically active. That is trying to keep them healthy. And what do they have available? Pop, chips, poutine, crap, basically.
And they're hungry and they're thirsty.
Exactly. And and a lot of parents find, well, yeah, they deserve it because they were physically active, but it doesn't really quite balance out. So we're really trying to work hard with recreation facilities to up that score by working with them and helping them to offer healthy products because, we've done a little bit of research with our group, and what we've found is that if we offer it, they will buy it. So if we offer 75% healthy stuff, people will buy 75% healthy stuff.
That's encouraging.
Yeah, it is encouraging. The area where we're doing the worst is around finances. So one of the things that we looked at is, could a family who was working on minimum wage or could a family who was living on social assistance actually afford to buy a healthy food basket and feed their family? And it's just not possible. You could be the best budgeter in the world, and it's just not going to work. So that's why we have things like food banks, right? Because people have to pay their rent. Yes. But food is always one of those flexible things. So we gave an F on the economic environment around the affordability of healthy foods, but there is one potential promising area, and that is Alberta Education has recently initiated a school nutrition pilot project, and so there are a number of schools throughout the province, particularly those in a more of socially disadvantaged neighborhoods who are now being funded to provide a healthy lunch or snack. And so we thought that was a really good initiative. We only gave a C, and the reason we gave a C is that we would like to see that be more universal. Every kid deserves to have a healthy lunch at school.
And it may, for the first time, introduce them to fresh produce and things like that they may never have had.
Yeah. Interestingly, yesterday we were at a session, and there were people there from schools talking about initiatives in their schools and how they got kids to be interested in eating produce and things like that. And basically it's just about having the chance to try it. If people have taste tests and they get to sample it, they say, hey, this piece of fruit is really tasty. It's sweet.
Sweet and juicy. I have a couple things I'm wondering about. Many years ago, when I was reporting, I remember when this chatter first started that one of the barriers, especially in the recreation world, were corporate sponsors that might have paid for scoreboards and things like that.
Oh yeah, that's still an issue.
We won't mention any names, but that was a big issue because they provided a lot of funding. So you're telling me that it is still an issue.
It is still an issue. It is still an issue. It's even an issue in schools. In that, scoreboards do have that kind of branding. What can be done is that even within those large companies, there are healthier options. For example, the large sugar-sweetened beverage companies all have water as part of their product line. So we would encourage that if a new scoreboard is coming, that you at least have something like a name brand water. It's better than having the pop up there, that kind of thing. But we certainly recognize why some of these things happened. A lot of it is around trying to make ends meet and government cutbacks and tough economic times. So we recognize that this is why it happened, but there are ways that we can work around it, and we shouldn't be compromising the health of our kids to save money.
What can you think of any solutions, or have you identified any potential solutions or ways to lobby in order to address that economic barrier? What can we do about those high prices? Can we do anything?
Yeah. Well, there's a number of things that can be done. I mean, first of all, I think we really need to look at having, for example, social assistance indexed to the real cost of living, as opposed to some sort of nominal amount that is based on history. So that's one. That's a large policy intervention that may take years to happen, but it's probably where we want to go. But in the meantime, there are potential quick fixes. So, for example, one of the things that we're advocating for is a tax on those sugar-sweetened beverages. There's been recent research that has basically shown that a 20% tax on sugar-sweetened beverages, which would be about 5 cents per liter, okay? If that tax was actually dedicated to health promotion or perhaps subsidizing healthy food products, that could make a huge difference. It could bring in millions of dollars, billions of dollars actually, across Canada, but in the hundreds of $millions in Alberta could bring in 1 year. It can also discourage its consumption, not unlike with tobacco taxes and how that has happened over the last 20, 30 years. So I think we need to start thinking about strategies like we used in tobacco around some of the not essential foods. So we could bring in a lot of money, discourage consumption, and then if we earmark those funds for subsidizing healthy products, providing health promotion programs, and even perhaps some sort of grants for schools to provide healthy foods, things like that, those are all potentials.
And we just need people to buy in and pay attention. We're going to provide the link so that people can learn more about the report card. Okay. Is there anything else you'd like to tell our audience?
We have funding to do this report card for another 4 years, so by the end we'll have had 7 report cards. So far we're averaging around a C. Last year we actually plummeted. We had a D, and I think a lot of that had to do with the economic environment. So what we're really hoping will happen is that people take a look at where they could potentially make a change. There's 36 indicators in there. What are you passionate about? What are you interested in? Where could you exert your influence to try to increase those grades so that by the time we finish in 2021, we're going to have an A.
And I guess one of the messages might be that you don't have to think on a grand political scale. You can make little changes at home or with the children, the young people that you know in your life that can make a difference.
Yeah, every little bit helps.
Thank you so much.
Thank you.
Thank you, Kim. And be sure to check out that link that we've provided for the 2017 Alberta Nutrition Report Card. Well, it's winter time in southern Alberta, and although we've had an awful lot of weather that doesn't seem very winterish, snow will come and go. And car seats, when we have babies in car seats, sometimes people bundle them up to try to keep them warm. We're going to find out today why that might not be such a good idea for safety. We're talking with Chloe McNamee. She's a health promotion facilitator with Alberta Health Services here in the zone, and she's going to tell us about aftermarket products that people can buy, sometimes make, for use with car seats for infants, and what the do's and don'ts are. Welcome.
Thank you, Sherry. Yes, so we don't recommend using bulky snowsuits in the winter just because it interferes with the harness system in the car seat. So we recommend that parents start their cars beforehand, put their child in the seat, buckle them up as you normally would in the summer months, and then put blankets over top once they are in the harness, just to ensure that the tightness in the harness strap system is the same to their body as it would be in the summer months.
Okay, because that thickness creates a bit of a space.
It does, and unfortunately, if you are in a crash, there is no there's no guarantee that the bulky snowsuit would keep your child as secure as it would be without the bulky
There could be some
snowsuit.
slippage.
Exactly, and we don't want to risk having the child slip out of the harness system in the event of a crash. So.
Okay. Now, I've had my children many years ago, and
Yes.
things were very plain and basic then. I see there's lots of things. There's covers and all kinds of cool-looking things people can get now. Talk to us about some of these products.
Yes, so we don't recommend any aftermarket products. So these are products that are sold additionally to the car seat. And we don't recommend these because they are not tested with Transport Canada. So every car seat in Canada, bought in Canada, is tested through Transport Canada to ensure that in the event of a crash, it would hold up to safety standards. So these products that are sold additionally aren't going to be tested. And so if you would put a blanket under the car seat, or you would use any padded cushions or anything in the car seat, we can't guarantee that these products would hold up in the event of a crash.
Okay.
And so it also affects your warranty. And if you had any of these products in use and you were in a crash, your warranty could be invalid, void, exactly. And so these products, they make it seem like they are innocent and they're just looking to comfort children, keep them entertained or warm. And so I understand that it can be a positive thing for parents to buy these things, but they actually can do more harm than good. So
You mentioned entertained, and that what brings to mind these things that sort of string across or sit on top of the bar for children to play with?
exactly. So any mobiles or add-on toys we don't recommend, as they are in front of their face. And so rear-facing mirrors. So when children are rear-facing, they're facing the seat of the back seat. And parents put a mirror on the headrest. We don't recommend those either, just because if you were in a crash and that was not held up properly on the cushion, it could fly and hit them in the face.
Big
and
projectile.
we do not want to risk a brain injury with something like that. I understand that it's comforting being able to see each other because they aren't facing forward.
Right.
However, it is just a danger and we don't want to risk that, right?
So what I hear you saying is that you're really not suggesting or recommending that people buy any aftermarket products, right?
Yes, correct.
Do the car seat manufacturers themselves produce any of these products?
Some of them are starting to, just so that parents will buy the same manufacturer product instead of something else. So they will make something in the same brand. So they are saying that parents could buy these. Again, it's just a good idea to check with the car seat manual and see what they say. If they say that you can buy the same product that will have a head cushion or something along those lines, then it will be safe. You just need to make sure with the car seat manual, your vehicle manual, anything like that, with trusted professionals, with different websites and resources that you can go to. So it's just finding the right information and the trusted information.
Okay, and we will put some of those websites up on the screen to help people if they want to do that research.
Definitely, yes. So going to Alberta Health Services website and searching car seat education, there's loads of information on there that parents can look through. They can also look at the Transport Canada website, and they can come to me at the health unit, and I would be happy. It's a free service. I would be happy to help parents ensure that their child is the safest in their seat. And I inspect and install car seats as well, so if there's any questions with that, they can come to the health unit in Lethbridge. And they have this service all over the South Zone as well. So just kind of looking at the Alberta Health Services website and seeing the nearest health unit that would help with that.
That's great, because I know, especially with a first baby, people are really concerned about making sure that it's right and that it's safe. So the fact that you will check this all out for free. There's just one little item I wanted to bring up, and that is the matter of buying a car seat, maybe through online sites or whatever, used. What are the hazards with that?
We don't recommend any used car seats. I understand that money can be an issue for some people. Car seats are very expensive, and so if you knew where the car seat was coming from, if it was a family member, you knew how it was stored, you knew that it was not in a collision, I will say that it is okay. However, we do strongly recommend that it is new, bought in Canada at a store, has the Transport Canada sticker. So that is a maple leaf that's sometimes on the bottom of the seat, sometimes on the side. But it will say in the manual that it has been safety tested through Transport Canada. If it's bought in the States, online, anything like that, it's not recommended, and I will not, unfortunately, help with a car seat that is not tested by Transport Canada, as it is a liability.
You just can't endorse it.
I can't, unfortunately.
Okay, that's understandable and great.
Yes, yeah.
Did we forget anything? Is there any other information you wanted to convey?
I think we've covered it. Yeah, just in looking for the right resources and ensuring that your child is safe. I understand that some of these products can be attractive to get for your child, but it does. They do look innocent, but they do cause more harm than good. So.
Terrific. Thanks so much.
Yes, thanks, Sherry.
Do your research. We're hearing a lot of buzz about the benefits of eating together as a family, and it's easy sort of to see that might be a beautiful thing, but sometimes people can feel pressure to do that if parents are working and they're really strapped for time. We're talking with Arlene Moore today. She's a registered dietitian with Alberta Health Services, and she's got some tips to help us figure out how to make that happen. Welcome, Arlene.
Thank you.
What are the actual benefits of a family sitting down to the table to eat together?
Well, when families come together and have meals together, typically it can have long-lasting benefits. And some of the nutritional benefits are that the children can eat more often. They can eat more vegetables and fruit, calcium-rich foods and milk products, and less of the sweetened beverages.
So you're basically giving it to them and sitting with them and making it sort of laying it out for them.
You're providing them with the healthy foods, and they're actually encouraged to eat together because they're enjoying the time you have together at mealtime. As well, coming together at mealtime can provide protection against the children becoming overweight. And along with these nutritional benefits, there's other benefits. There's increased academic success. When families are talking together at the family, children typically have more improvement in their vocabularies. And along with these non-nutritional benefits, older children and adolescents are less likely to smoke, use drugs, or alcohol.
Wow, that's really far-reaching.
It's wonderful. It's a simple thing to do. Come together. I know it can be challenging, but it's also enjoyable.
So, what can you tell parents to help them? What kind of tips can you give to help them structure their time to actually make it happen?
Yes, it can be a challenge because parents and families and children are really busy, particularly with homework, after-school activities. So some strategies that are suggested are to choose nutritious and recipes that are quick to prepare. In fact, build a collection of recipes that you can go in and out of the kitchen under half an hour, and try accessing the Alberta Health Services Healthy Eating Starts Here website. There's tremendous recipes that you'll find on that website.
Recipes that you can make quickly, or maybe some things you can do ahead on the weekend, maybe?
Yes, and also to save time, get the whole family involved in the shopping. And before you shop, of course, you're going to need to plan for the grocery list and the preparation of the food. And this offers hands-on activities for the children and the whole family together as they learn to chop vegetables, make salads, set the table, pour drinks.
So there's a teamwork aspect to it, there's the learning of the skills, and then if they're involved in the meal preparation, they sort of become a stakeholder in the meal. They're involved, they would probably care more.
Yes, and they get encouraged to try the food that they are creating themselves. As well, if the timing of the meal, let's say dinner, conflicts with the activity, then be flexible, shift the time of dinner, or have breakfast or lunch together instead.
Okay, at least one meal a day.
Yes, together is really highly recommended.
So we've talked about what the benefits are, which are far-reaching beyond nutrition, to sit down for a family meal. We've talked about some ways to kind of help facilitate it, make it happen. Can you help us with any sort of ideas to make it more enjoyable and more fun?
Yes, come together at the table and enjoy the meal as a family and have conversation that's positive. Remember, as parents, you're the biggest influencers when it comes to your child eating healthy. When they see you enjoying healthy food, they'll be more apt to try new foods. As well, when you're offering your child a selection of healthy food at the table, allow them to decide what and how much they're going to eat. Children need to stay in tune with their own feelings of hunger and fullness, and this will help prevent overeating. And remember, children's appetites can vary from day to day. They may just not be feeling well, or they may be more active, or they may be growing. So it can vary for sure.
That's a really good point, because I know a lot of people are raised with that clean up your plate rule, and that may not be the healthiest rule to have.
Right, because we want to let the child decide how much that they want to eat.
To stop
or
eating when
feel
they're
like
full.
Eating, because even you and I get fuller on different days, right? As well, turn off any distractions such as the TV and phones, and instead tune into your loved ones and enjoy the meals that you created.
Make eye contact.
Exactly.
Thank you so much.
Okay, perfect.
Enjoy your supper together. We're here at the Community Health train station in Lethbridge with health promotion facilitator Megan Burland, and we're talking about National Non-Smoking Week. This year in the zone, we have a special focus, and Megan's going to tell us all about it. First of all, welcome.
Thank you. Yeah, National Non-Smoking Week is coming up fast. It's always right after Christmas when people are thinking about like New Year's resolutions and maybe motivation is high. So National Non-Smoking Week this year is January 21st to 27th. And here in the zone, we're encouraging people to try doing practice quits.
Okay, so that maybe makes it a little bit less intimidating, so you can
Yeah.
kind of ease into it?
Yeah, so you could pick like a practice quit anywhere between maybe a day, 2 days, all the way up to maybe 5 days. And it's like a little bit less intimidating, like you said, a little bit less of a commitment, but it gives you a chance to build some of your confidence and learn a little bit about your tobacco use.
Okay, so what are some of the tools then that you use to help people do this?
Well, they could start by tracking their tobacco use. That's something that we encourage a lot of our clients to do, just to see if you can see trends like when you're having most of your cigarettes or using most of your tobacco, if you're feeling sad when you're using it, happy, kind of in the middle, the time of day, things that you're doing maybe when you're driving or talking on the phone. Many of our clients know a lot about their tobacco patterns already, but tracking is a really great way to kind of unveil some of those patterns and plan for them when you do go to do a practice quit or a full quit.
It seems very similar to me to some eating plans where you
Totally.
have people track their eating and then they start to become aware of
Yeah, and
where their places are.
it's kind of like annoying to do as well. So in one sense, you're kind of tracking to find those trends, but in another sense, by tracking, you start to do some automatic cut down already, because it's just annoying to have to track them, and you're a little bit more conscious of when you're smoking. So we see kind of an automatic drop in cigarettes or tobacco use by just doing the tracking. So it's a great tool.
So if someone's doing a practice quit and it's just a short-term thing to see if they can build up their confidence,
Yeah.
do you recommend them using any smoking cessation aids like the gum or whatever, patch, or are there other techniques that you recommend for that sort of thing?
Yeah, they could kind of talk to their pharmacist. We know that by getting support, you can double your chances of success. So even in a practice quit attempt, we would really encourage people to get support. And we have a special support option for people that are going through a practice quit, and it is the text to quit option. But people will get kind of supportive text messages for 3 weeks that might help them to try and decipher what their motivation is, how motivated they are right now. So they're targeted text messages for people in that practice quit mentality. To get that support, you can go on Alberta Quits and sign up for it, albertaquits.ca.
Okay.
Or you can simply text AB Quits, ABQUITS, to 123456. And when they text you back, just they'll kind of ask you for a quit date, and you can text back just saying thinking,
Okay.
and then they'll know that you're doing like maybe a practice quit and that
Okay.
you need some encouragement and to kind of determine what your motivation is right now.
So really flexible and kind of gentle, very supportive.
Absolutely, yeah.
Okay, and if people do, like, either they go through the practice quits and then they decide they really want to try to go the whole way and quit
Yeah.
completely, or they don't do practice quit and they just want to jump right in and quit, we have other things available too, like talk to us about Quit Core.
Yeah, so like I said, getting support is a really good place to start, whether it's on our online service, Alberta Quits, through the texting program, on the phone. It's all free and confidential. And then we also have our group programs starting across the zone. So our Quit Core program is a free 6-week program. I think we have them going on in Crow's Nest Pass, Lethbridge, Medicine Hat, Brooks. So you can go on albertaquits.ca and click on the groups page and find out when a group is starting near you.
Okay.
And it's a really, really good opportunity to connect with other people who are quitting.
Awesome. And like you said, this is the perfect time of year.
Yeah.
People are eager to make changes.
Yeah, absolutely.
Did we forget anything?
No, but here in the zone, we will be working with local employers to encourage some discussion or some thinking around practice quits for National Non-Smoking Week. So here, for example, we have like a practice makes perfect bingo, and it encourages people to kind of pick a challenge every day to work on during their practice quit.
Okay.
So one example is stopped using tobacco in one difficult place, like my car or garage. So that can be kind of a daily challenge to kind of work towards the bigger goal of quitting or practicing to quit.
Oh, and so it's sort of fun and also small bites.
Yes, exactly. So this is one example that we're doing at the University of Lethbridge, but we'll be working with other employers as well.
Awesome. Thanks for all this.
Yeah, no problem.
We wish you luck if you want to make some changes this year.